Good afternoon. We're just trying to make it a little fancy with the interlude. Like I said, working from home, one of the aspects that make it different from working at the office is the technical part of it. So here you go. This is the update from of today. Like I told you before, that me and Nat Bunnak, the another anchors of Thai PBS World, will take turn giving you midday update on what's going on with the COVID-19 situation in Thailand, right? Not right after, but not too long after the CCSA finished the daily briefing. So you will get the official number and you will get bits and pieces that we think that it's important for you to know concerning the COVID-19 situation from around the country. So today, let's start with the announcement from the Royal Gazette. I'm gonna show you the website of the Royal Gazette. Some of you might be able to read it, some of you probably not, but here is the Royal Gazette announcement that published last night on the website. An announcement in the Royal Gazette states that Samut Sakhon, Chonburi, Rayong, Trat, and Chonburi province are designated as the highest level strict control zones and will see tougher travel restrictions. And today we will explain what is that tougher travel restrictions. The local authorities have the power to examine and control the use of transport routes and vehicles. There will be more checkpoints set up to intensify the screening of people entering or leaving the areas. Only essential travel allowed with the permission of local authorities. So when we talk about the permission of local authorities, Dr. Tawisin said in a press briefing, because there was a question from the media asked how to get those permission. Dr. Tawisin said that it's just simply a letter of authorization from either village head, it can be the village head of your village, or the district chief, sub-district chief, or the provincial governor itself, but you don't have to go that far if you can get in touch with your village head. And also if you are employee of, let's say, some shipping company that you have to do an important route, driving around, shipping between provinces, you can get also a letter from your employer as well. And it just has to be obviously stated the necessity of this travel. So the Prime Minister Prayut Chan-o-cha issued this directive under the state of emergency, which this state of emergency has been extended 9 times already. And the latest one will end at the end of February. The residents in these 5 provinces must use Mo Chana or Thai Chana tracing application. Let me remind you again. These 5 provinces is Samut Sakhon, Chonburi, Rayong, Trat, and Chanthaburi. It's all in the eastern part of Thailand. Those found guilty of violation of the new directive are liable to a prison term of up to 2 years and or a fine of up to 40,000 baht. So you don't want to do that. So here you go. And this, we will go to the press briefing by the CCSA Dr. Tawisin Wissanuyothin. Let me share you the screen of his announcement. So at least you get to maybe see some of the graph and things like that. So what he was talking about, he was saying that today Thailand records 305 COVID-19 cases. That was actually just right before the press conference start. He got a memo that Buriram also finally have a positive case, but he said that will be included in the figure tomorrow, official figure tomorrow. So today there is no Buriram on the list yet. Thailand record 305 COVID-19 cases today, bringing the national total to 9,636. We are getting very close to 10,000. There was also one more fatality, a bedridden 88 years old who was also suffering from cancer. He was infected by his son who had visited a gambling den in Rayong province. His son visited the deceased on the December 22nd and later tested positive for COVID-19 and was admitted in Rayong hospital. His 88-year-old father tested positive on January 3rd. You can see the timeline here. About, let's say, 8, 9, about 12 days within the 2 weeks. His father got tested positive for the COVID-19 as well, and he passed away only 3 days after he tested positive. The province recorded the highest number of infection in the past 24 hours is Samut Sakhon, with 146 cases. Dr. Thuisin said 109 cases of those are from proactive screening, which means they went to the market area, they went to the high-risk area, they went to factories in the province just to make sure they screen as many people as possible. So the second highest number belonged to Bangkok, 40 new cases. And there is also a very high concern cluster, 88 cluster cases, the one that's stemming from a cockfighting ring that has spread to 5 provinces. There are total 88. At first there were 38, now 88. 50 in Ang Thong province, 15 in Ayutthaya, 13 in Suphanburi, 6 in Lopburi, and 4 in Singapore. Like Dr. Thuisin yesterday, that most of these cockfighting rings are actually legal, but right now he recommends to stop operation. Like in Bangkok, there is an announcement that all these animal games have to stop operation at the time being. And also in the 28 red zone provinces, all these activities should stop temporarily at least. The CCSA has ordered security officials in all 28 red zones to set up checkpoints on the main route. You can see in the screen right now, let me make it a little bigger. This is the red zone I'm talking about. Just, you can see that it's quite in the middle, Bangkok included, and there is a dark red. Dark red is the 5 provinces. The red zone is the 28 provinces. CSA said that the 28 red zones to set up checkpoints on the main routes in and out of their provinces. Village and sub-district heads and district chiefs are also to set up checkpoints on smaller roads. The main one will be in cooperation between the provincial officials, with the province officials and the security officials such as military unit or the police unit in the province. So the government is asking businesses to support working from home and education institutes to use online platforms, even though they are not in the high-risk area under the order or directive of the CCSA, but it is best to try to limit the movement activity as much as possible. So all this request is to minimize movement, and hopefully we'll be able to curb the outbreak. Dr. Thuisin, also referring to the new directive that I told you a little earlier, that the one that published in Royal Gazette, that reiterated the 5 important measures. We talk about this every day. Maintain personal distance, wearing mask, washing your hands, monitoring your temperature. This is another one that they added on top, just monitoring your own temperature. Downloading the tracing application and complying with the quarantine restrictions in designated areas if you are asked to do so. Talking about the tracing application, yesterday we talked about Mo Chana and Thai Chana. Having said that, Mo Chana should be something a little more in detail, and Thai Chana, just one of them. You can use any one of them. Mostly you will see the barcode at all places, all the venue. Mostly is from Thai Chana, but Mo Chana you have to do manually yourself, but Mo Chana will be something in more detail. But these applications will help the authority to trace people that has been in contact with the infected person in case you have been in the same space, same venue, at the same time with the infected person, so they will be able to trace to you and contact you and let you know that you are in a high risk or in a risk group. So Dr. Tawisin talked about the authorization for the movement between provinces that I already explained a little earlier, that it can be from a village head, a sub-district chief, district chief, or a letter explaining the necessity of the trip issued by the employer. An announcement also increases the punishment of human trafficking, specifically for migrant smuggling rings, which the government regards as the cause of this latest outbreak. The Border Patrol will be more stringent, and the public are asked to report illegal activities via the CCSA hotline 1111. If you see anything out of ordinary, if you suspect maybe something has to do with the smuggling rings, just dial 111 to give some tips to the CCSA. It's the direct line. So as for the importing vaccines, the government said that this is the question from the media asking about earlier that Vipawadi Hospital was ordered to stop advertising for the pre-sale of the vaccine. And Dr. Tawisin said that that order was because those particular vaccine hasn't been approved by FDA yet. So if the vaccine has been approved by FDA and the hospital already acquired or already make a contract and will get it, then they can advertise for it. But these vaccines have to be approved by the country of origin before export, and then by FDA in Thailand before it gets to use. So the government said that they has no intention for barring anyone from importing them, but they must be approved by the Thai Food and Drug Administration or FDA before being made available to the public. So even for the pre-sale, if they want to advertise for the pre-sale, this vaccine have to be approved by Thailand's FDA already. Yesterday, there was a question about whether Thai people have to pay for these vaccines. The government is trying to get that by the end of May, we should have something like 28 million doses. And by the end of this year, the government said that they would be able to inoculate somewhere around 60 million people. The Prime Minister said yesterday that these vaccines will be free for Thai citizens. So there you go, guys. And he said it will be free. Not sure about the plan to distribute it yet, but it will go, the first batch that coming in next month will go to the highest risk group first, which is the medical personnel, the health volunteers, and the field officials that has been working in the extremely high risk zones, such as in Samut Sakhon area. Now, this is something a little more local. Something happened in Bangkok. There was a news last night. That it's actually happened at the toll booth. The Expressway Authority of Thailand, or EXAT, has reported that one of its employees tested positive for COVID-19 on January 5th. The employee is a head toll collector at Teparak toll booth on the Bang Pli Sukhsawat Expressway. Now, don't be so alarmed, because from the investigation by EXAT itself, it's revealed that the employee had not been working at the toll booth and has not been in contact with any customers. So the last day he was at work was January 1st. All employees who had been in contact with him are being quarantined for 14 days. The EXAT has closed both off and on ramps at Teparak for 2 days, which is yesterday and today. And it will reopen as usual Friday, which is tomorrow. So just to let you know, it happened closer to home than you think, okay? So just washing hands, wearing masks, keeping distance is the best vaccine you could possibly have. Now, let's go to Chiang Rai province. Chiang Rai yesterday they organized the daily meeting about the COVID-19 situation, and they said that they will set up a migrant volunteer team to help officials communicate with migrant workers. The Deputy Chiang Rai Governor Warawit Chaisawat said that anyone entering Chiang Rai from the highest control and strict zone, the 5 provinces that we mentioned earlier, have to be quarantined for 14 days. This also the same goes as the Chiang Mai province said yesterday, but this now has been very, the CCSA tried to make it as inconvenient as possible to minimize the movement between provinces. So, but if you happen to go, you have to be quarantined for 14 days, or if you don't plan to stay there to 14 days, all the duration of your stay, just have to be in quarantine. The province also prepared to set up a field hospital at Blauw Hospital, and there will be a hotel to accommodate mild symptom patients. Chiang Rai was one of the provinces that an infected case from Naksompop visited before tested positive for COVID-19. The province identified 19 high-risk persons under investigation, 10 of which has negative test result. There are also another 107 low-risk PUI or person under investigation under observation. So, again, like Dr. Tawisin said, that right now on top of the 3 measures, distancing, washing hands, wearing masks, he also asked everyone to download the tracing applications to make sure that it's easier for the official if they have to trace you later. Now, we're going to go to the news that involve sports a little bit. As you know, that there are going to be a badminton tournament in Thailand very soon, and we just had the news a couple days ago that Japanese badminton player have to withdraw from the tournament. The latest news is that the Badminton World Federation just reported that the Indonesian men's doubles top badminton players have been forced to pull out of the next week's Thailand Open badminton after one of them, Kevin Sanjaya Sagumo, Kevin Sanjaya Sagamujo tested positive for coronavirus. The withdrawal of Kevin and his teammate Marcus Fernaldi, affectionately known as the Minions, people call him the Minions, in the latest loss of badminton's three-star tournament, which is already missing the star-studded Chinese and Japanese teams over coronavirus concerns. Kevin developed coronavirus symptoms last month. He is the one on the right, the one without the golden highlight there. Kevin developed coronavirus symptoms last month, including a loss of taste and smell and a mild flu. After testing positive, he has been recovering in isolation at his home. The Thailand Open is the first of 3 tournaments scheduled to take place in Bangkok in consecutive weeks, kickstarting the world tour after coronavirus ravaged last year, 2020. Earlier, top badminton players from China withdrew when coronavirus rules prevented them from leaving the country, and Japan were forced out after men's world number 1, Kento Momota, tested positive before departure. However, on Wednesday, which is yesterday, the Badminton World Federation said that all 824 people, including players, coaches, and umpires living in bubble conditions in Bangkok have tested negative and were cleared to train under strict safety protocols. Now there is a question coming up whether this tournament will be canceled, but they are all already here in the bubble condition, so probably gonna go on. Now let me see, I got some comment. My flu and at his home sounds so deadly, 63 died. Okay, right now Thailand, yesterday was 66, so today is 67 deaths. And we are asking everyone to limit their movement, work from home is possible, and try to stay home as much as you can. Everything you just have to do online as much as possible. If you have to go out, washing hands, wearing mask, keeping distance, and don't forget to download Thai Chana app or Mo Chana app. It's a tracing application on your mobile device, so they know where you are. Or if you cannot remember where you were, if you happen to get positive result, at least these apps will help you, especially Mo Chana app will help you to tell you where you were in the past several days. And that is all the update I have for you today. Hopefully it has been useful information, and we will come back to you at 7 p.m. at the Thai PBS World Tonight with Nat Bunnak and me, Tulip, Naksompop, Blauw. And we'll see you at 7 p.m. tonight and see you again tomorrow at 1 p.m. And if you want to know more updates during the day, follow us on Twitter, follow us on Facebook. We also have our own website that we update constantly all day, especially Twitter is very active. Thank you for watching and see you again 7 p.m. tonight. สวัสดีค่ะ